Hi everyone, I'm going to walk you through the very simple process of using the AJAMI tool to save you significant time and reduce burnout from too much clerical work. You need to enter the URL or the link, or you scan the code that you see on your screen. It brings you to this page. Now, for users who already have an account, of course, you click on the sign in, but then if you're using it for the first time, you click on the free sign up, and then on this page, you provide us with your name, and then I'll be entering the name of my hospital. Once you've done that, you scroll down, and then you see the different templates that there are. Now, what templates means is that whatever niche you have as a doctor, you select it, and this will help create the notes more accurately. So I will choose the dental care and then choose my country as Nigeria. Yes, you agree to this, that you're a health professional, and then you agree. And now when you click the agree, it brings you to this page. All you just need to do is to go back to the previous page. Once you've done that, you click next. Now when you click next, what you provide us with next is your email address. So in my case, I will just enter my email address, and then you enter a password, and then you confirm the same password, and then you create the account by hitting the create an account. Now, your browser might give you this pop-up. It's good to always save your credentials so that next time your browser pre-populates. But if you're using a public computer, you might want to cancel. But since this is my personal computer, I'll hit save. And then this is the AJAMI dashboard. In your dashboard, you have the home section, you have the consultation section, and then you have the patient section, and you have the settings section, and you have the contact us section. When you're attending to new patients, what you will be using will be the consultation section, which is in the home. Now, to start a consultation, and then you hit the start consultation. So if I hit the start consultation, I'll start speaking to my patient, and you'll see automatically generate what I'm doing and then create a summary. So let's do that and see. Now, when asked this pop up, just say allow while visiting this site. This is just to permit your browser to be able to use your microphones or any of the connected recording devices. Now you allow this, and then you get this pop-up just asking you to always remind your patient this will be recorded, and then when you continue, I will pretend to be speaking to a patient, and then I will get the summary. If you want, you can pause or you can stop your recording. Now if you pause it, you can always resume back. But then if you hit the stop, it automatically stops recording the session with your patient, and then automatically generates your notes for you. So let's wait for this to generate. Now this has been generated. So we see that everything that I have spoken will be generated here and summarized. Now, when your summary is generated, you see that the consultation session can be changed or given a name. When you hit it, you can say patients, or let's say John. If you go down, you see that our session has been automatically summarized. Everything basically you've told your patient will be generated here. And then you can go ahead and add other notes that you have observed, like disease conditions, medications. And then you see down here, patient instruction, reasons for visit, all of these have been generated for you. You can copy and transfer to your preferred platform, such as your EMR, or even send it to your patient. You can send it to the patient by clicking on the send patient instruction. And then if you have not added a patient before, when you click add, then you can add John's name and John's email, and then add his phone number. and then we can save. With this done, we can select our John or add another recipient, and then you send them the final summary. Now this will be automatically sent to their email and their number, and then you can always switch between the transcription to see what was recorded during this session and also the summary. And if you're not satisfied with what was generated, you can regenerate another note, and you can always click to edit the information that was summarized for you, and then hit the save button. On the consultation side of the dashboard, it keeps a list of all the patients that you have done consultations with. If you click on a patient, you can go back and see a history of everything that happened previously with the patient. This is helpful, especially when a patient returns. You can use this to keep track of previous things that has been discussed with the patient. And then when you come to the analytics, you see analysis of all the sessions that has happened between you and patients. This summary helps you keep track of consultations that have been done and then analysis. For your patients, so your patients are a list of people that you've added or sent details of your consultation session with. So in our case, we added John's detail and we have him added as our patient. Now on your settings, this allows you to change your name, change your hospital's name, change the language, or change the template which you're using. And you can see a QR code which you can click. Now this is helpful if you want patient to automatically be added to your patients list. Once they scan it, you just download it and give to patient, and once they scan it, they will be automatically added to your patients list, which is here. If you also want to log out, you just click the log out button and you'll be logged out. And then here, if you do have any feedback for us or any questions or reports, you can always send us a feedback. When you sign up to AJAMI, you will receive an email from us confirming that your sign up has been successfully done, and then you also receive a follow-up message as this from our team. That is a quick run through, and we are looking forward to having you explore AJAMI, your consultation sessions. Thanks for watching.